are going to be here together for 2 hours since now. You can, if you would like to ask any questions, please raise your hand. I will ask you to talk, or you can also write your questions to the chat, and I will read it after the speaker ends. The current speaker ends. We have just 2 hours and so many things that we would like to share with you. So I'm not sure that we will be able to answer all your questions. If not, we are going to answer your questions by email after the meeting today. Okay, so please, next slide. So yeah, I would like to introduce our organization in the beginning. We are active since 2011. And on the left side of this graphics, you can see the main topics that we are dealing with. And on the right side, you can see the current projects. You can see also the project port that I am going to talk about, or we are going to talk about today. And I'm sure that our president, Alenka Felcmanová, who is here now with us, will later on describe some of the other projects too. Okay, so please, next slide. Yeah, so who are the speakers today? So that's us. Me, Leona Pejcharová, as the manager of the project, and Lenka Felcmanová as the president of the organization, but also the supervisor of the outcomes, and our expert team. Okay, so yeah, there is not Jiří Merta. The photo was there just several whiles before, but it's not there now. But he is here with us too. It's also the member of the expert team, and he is like technical support today here. But you are not going to meet him, yeah, on the screen. Okay, so Jiří, please, next slide. I am trying to be really, because there is so many things we would like to share with you, but let me introduce you also the another teams that we have in the project, so that you know that really there is a lot of people involved, and that's the national supervision team, where are experts or representatives from national institutions such as Ministry of Work and Social Affairs, also representatives of National Pedagogic Institute, from the Association of School Headmasters, or National Institute of Mental Health, etc., and also of our partner ROSA, which is an organization that focuses on support of women victims of the domestic violence. From the international supervision team, I'm happy to see here Steve Goodman, who is here today with us. It's an expert in PBIS from the United States. So Steve, hello. If you would like to say anything, the floor is yours now, if you would like to greet us.
Oh, yes. Hello, everyone. It is such a pleasure to learn more from the work from the SOFA. I just want to mention how impressed I have been with the quality of the work, with the accomplishments that have taken place over the last, the last period here. So congratulations to you all, and I wish you much continued success.
Thank you very much, Steve. And yeah, there are also other experts. We are very happy to have also Hedda George, also expert in PBIS, and Kaja Johannes and Lars Lister from Norway, who specializes in the trauma-informed approach, and also our partners and experts from the Visegrad countries, which are Poland and Slovakia and Hungary, who help us with the localization and translation of our materials, so that we can disseminate our outputs of our projects in the whole region. Yeah, so next slide, please, Jiří. Today we are going to share with you the experience that we have obtained during the 2 years on the project PorT. The project PorT, the name is an abbreviation of Czech words porozumění traumatu, which means understanding trauma. And it has been funded by the European Union by the CERV call. On the slide here, you can see the most important outputs of the project, and we are going to describe it more precisely during the 2 hours. So, and you are also going to see one of the videos. We would like to make the meeting as interactive as possible. So there will be also some activities for you to get involved. So I hope you will enjoy it. And now I would like to pass the floor to the next speaker, which is Lenka Felcmanová, our president of our organization. So Lenka, the floor is yours. Thank you.
Thank you very much for being here with us today. Again, I would like to thank Steve Goodman for his kind and expert support during the project. Positive behavior support is one of the core concepts we build upon our training dedicated to teachers. And it will be further introduced. Please let me just give you a few words about the situation in Czech Republic and our mission and why we are doing what we are doing. We unfortunately do not have very good system of detection of children at risk in the Czech Republic. Based on the national data of adverse childhood experience study, we know that in our country we have significant numbers of cases of physical abuse, sexual abuse, emotional abuse, and neglect, and other adverse childhood experiences. Unfortunately, the reporting rate is very low. Here you see, the yellow figures are the cases when we look at the age group 0 to 19. We have a total 2,160,000 children in this age, and you see the numbers from the study, the A study. The A study is based on self-reporting. So we calculated what is the share of the population suffering from ACEs. And the red figure is a yearly report rate. So it's a number of cases that it's yearly reported to social protection services. So even if we count it for the whole 19-year scope, we still don't get the numbers of kids. So many kids are undetected and exposed to traumatic experience for many years during their childhood, which of course has effect on their quality of life, their health, physical and also mental. So our mission is, please next slide, is focused on a different or includes different actions. I would like to share some of them with you and also make you understand that the PorT is a part of, very significant part of our efforts and where it fits. Our key mission is really to make early detection of children at risk more effective and make sure that the kids will receive the support they need timely and the way that can really help them. So we created a national tool for identification of children at risk that is dedicated, or it was developed for all professionals working with children, people at schools, so educational staff, social workers, health system, police, firefighters, and all others who have potential to meet with kids and meet with children at risk. And I'll show you how we always try to disseminate things, and we'll talk about the kit card later on. We are also trying to introduce a case management at schools. So it's, yeah, as a tool of a social work at school. We don't have a social work as a part of the services that is provided at school. That's one of our key advocacy goals, that we need these services, and we are piloting case management at schools, and we are providing inputs for the Ministry of Labor and Social Affairs and Ministry of Education, how it should be implemented, how the service should look like. So we have a pilot regions where we always pilot different tools, and then we generate the learnings, and we are trying to transform it to more system measures. And what's also a problem here in Czech Republic is lack of coordinated cooperation among different stakeholders that are involved in the support of children at risk. So when the school staff doesn't know what the service providers offer. There are many uncertainties also about what the social protection office does. So our another goal is to have a coordinated cooperation as a form of support, also embedded in legislation. So that, basically, so in every town or a group of villages, there would be a person responsible for this coordinated support of these stakeholders for their education, for planning their meetings, and also helping them to come with agreed guidelines and solutions that are applicable within the region they serve. Very important part, and this is what the current project we are introducing you now is about, is trauma-informed education and care. We are trying to educate all those who work with kids in the concept of trauma-informed approach. And the mission is also a long journey, but we are trying, with great cooperation with our international partners to introduce different tools, and the training we will introduce to you now is one of the key tools we use. As I said, we always try to turn good practices to system. So we are connected a lot, even though we are NGO, we are cooperating a lot with the different ministries, and we are trying to transform the good practices to system. And also what we are lacking here, and what we have been developing, are parental skill training programs, because it's also part of our mission to help parents, especially those who have their own traumatic experiences from their childhood, to have skills that help their kids to thrive and to stop the generational transfer of trauma. So please, next slide. So basically, just a very brief introduction what KitKat is. It's a real leaflet. It's not a big thing, but big thing is around it is that we finally agreed with a different profession on what are the signals of child that needs help. What are the physical signs? What are the signs in behavior? What are the signs of parental approach to children? And what are the guidances for a situation when there is some imminent acute threat to the child, and police and social protection service has to be involved immediately. And also the guidance, what to do if we see a child with an emerging problem, but if not addressed early enough, it can later turn to more severe problems. And we agreed with all respective ministries, Ministry of Education, Health, Labor and Social Affairs, and also Interior Defense, that the material will be distributed among all the professionals. And we developed other supporting materials. So please, I'm sorry if it's in Czech, we will have also versions in English soon, but of course it reflects different context, like legislative context. So, but what is crucial there is a national card which gives the national contact. What is more important is the local part, and this local part is being developed by the platform of these key stakeholders, and it's guided by the coordinator of the multidisciplinary cooperation. So basically what we do is we sit at the table with teachers, social workers, police officers, doctors, and others. Please, can we get back a little? Irka? Yeah. Other stakeholders from the town, and they agree on a situation. They describe that they are most frequent for their settings, and they agree about the contact. What will be the procedure? So basically, they write a situation. I assume that the child is maltreated by parents, so there are the contacts and what to do list. So it's really crucial that the people work together and they agree on also like what is the procedure, who should be contacted in the situation, and they all know about it within this town or district, which is the most important thing, that the people communicate, they agree, and they know each other, so they know they will be calling this person they meet on a regular basis. So this is something we would like to spread. We have now pilot regions where we trained already people involved in support of children at risk, and this coordinated cooperation and all the tools around should be implemented on a national legislation, hopefully. So it's going to be a long run, but we are preparing a new law which should include this. So hopefully the political situation will not switch and we will succeed. So please just let's go on briefly to through other supporting materials. So please, next slide. Yes, there are additional more like informative materials that are addressing early identification. Next slide, please. There is one specific material for schools, because what we heard from school, we don't know whether the situation is severe enough, so we should involve social protection services. We don't want to, there is, of course, there is a fear among people, to point at the child and the family and say there is something wrong. So we created with our key psychologists and experts in social protection some indicators that help them decide whether the school staff should reach out for the social protection office, or if it's the time to provide the coordinated support within the school with the support of other services. So there are different indicators, and there is always, like, the ping is something we expect, that it's normal. This orange is, there is this emerging risk, but we are able to treat this with the tools we have and with the network of support we have. And the red one, this is the time when we see this, no question, we need to reach out for the social protection office and police if needed. So it was very helpful, because I don't know what is the situation in your country, but of course reporting is not easy thing. People are worried if they will not harm the family or the child. So we wanted to give them some guidance that will really clearly help them to decide if they are not sure 100%. So please, the next slide. And we created also additional materials for children and parents, for kids, like describing in their words what are the situation and who they reach out to if they need. And also for parents, there are different life situations parents get in. So where is the help that can be provided? We have also the local version of these materials that are provided at schools, health practitioners, social services. So there are localized contacts to the support that is available within the region, or is within the town or district. So please, next slide. And we also created e-learning that it's focused on identification of children at risk, which is for free, and it has different modules for all these professions we talked about, for school staff, for social workers, for health professionals, and police. And we succeeded that we integrated this e-learning to where the professions have obligatory trainings, so it's a part of it. Some professions don't have obligatory trainings, but we communicate with the ministry, so it's recommended to go through. So there is some also like training support available online, helping them to learn more about the identification process. They can download the kit card, make their local contact list, and other things. Yes, so and this person here is a very famous Czech actor, so we wanted to make it attractive for people. So let's go on. And so next slide, please. And the final thing is that we prepared social emotional learning program that is focused on the topic of identification, on like introducing the different situation kids can get into, and also so the teacher can use that there and talk about how, like for this case study, what we can do, who they would reach out at school if somebody in their class or their friends would be in such situation. So it's like helping kids to understand different situations kids can get into, and also helping them to learn what to do in such situation. If something is happening to myself, or if something is happening to my friend, who to reach, what is the safe way to address this problem. So there are for different ages there is this these handouts for teachers. They can address the topic if they need. So I just wanted to show you how we think about things. We still know there is a lot of work ahead of us, and there is the model of timely support of children at risk we would like to have embedded in our legislation. So I was, sorry, it's in Czech, but there is this coordinator of interdisciplinary, multidisciplinary support, which should be in every town or a village district, that is helping to connect all these professionals that are around kids and help them to come up or agree on locally specified solutions for children. For those professionals, we have the trauma-informed approach training. We will introduce you, and we have the mission to train a quarter of professionals until of the whole country in next 5 years. So hopefully we will reach that. We'll see. The ministry might help us with that. And then we hope that every school will have somebody who will be able to do case management and help those kids and their families who have mild problems, but if not addressed well, they could turn into more complex problems, and the social protection would be needed later on. So we are trying to address the prevention, and the case manager or social worker at school can help that a lot. It's not something that we have in a system yet. We know that many countries have that, and there are very good experiences with this kind of service. So that's our aim to have it here in Czech Republic as well. And so it's briefly part of our work we do. And Yes, I don't know if I have one more slide or if it's, oh, no. So I would like to give a floor to our colleague Marketa from Rossa. Yeah, you heard from Reona that Rossa is organization focused on support of victims of gender-based violence. And yeah, we, as a two Czech partners, we work together on this project. Yeah, so I'll stay with you. And if there are further questions, yeah, do not hesitate to ask me, or you can write your question to chat and I will try to reply. So thank you very much for now.
So thank you very much, Lenka, for your introduction. And yeah, Marketa, go on. The floor is yours.
Thank you. Thank you for the floor. So good afternoon, everyone. As it was said, my name is Marketa Kroftova, and I'm from the Rossa Center for Women Survivors of Domestic Violence. My task in this project was to bring the focus on domestic violence as one of the potential sources of trauma in children. The study names several adverse childhood experiences, but in my part of this course, we paid particular attention to the issue of domestic violence because of its frequency, its hiddenness, and the impact it has on children. Among the many impacts, I can mention taking responsibility for abuse or fear of abandonment, social isolation and difficulties in relationships with peers or with adults, low self-esteem, stress-induced disorders, and what is typical for children from households with domestic violence, problem solving through aggression, verbal, physical, towards peers or adults or animals, and not taking responsibility and blaming the others. As Lenka said and shows the underreporting, I have my own statistic for you. This infographic shows statistics and researches for year 2021, indicating the number of children affected by domestic violence. According to UNICEF's Young Voices research, it's in the middle. 1 in 10 children witness domestic violence in the family. 50% of children surveyed experience screaming and fighting, and 9% of children reported being beaten. We have our own statistic from our center, and in this year, we have 211 women clients which attended our center, and they had 348 children under the age of 18. And only 2 of these children did not witness violence. This data comes from our questionnaire and our research. And this number, I have to mention, are only from women from Prague and surrounding. The first statistic in the bottom comes from the Social and Legal Protection of Children Authority, and the numbers are for whole Czech Republic. The Child Social and Legal Protection Authorities have caught around 2,000 cases of child abuse and neglect. Of these, 525 children faced physical violence, and 746 children faced psychological violence. You can see the difference between our internal statistic relating only to Prague and surroundings and the number for the whole Czech Republic. It shows that cases where children are witnesses of survivors or survivors of domestic violence are underreported. Next slide, please. What we wanted to convey to the course participants is the message that in case of children affected by domestic violence, it is necessary to choose a specific approach focused primarily on the safety of the child and the safety of the parent, survivor, parent victim, as you want. This can be achieved by measures such as separate meetings with each parent or supporting parent who is experiencing domestic violence in dealing with the family situation. And also for a child who is at risk of domestic violence, the home is not a safe place. The school or social services environment may be the only island of peace and safety for the child. It's a place where they can confide and receive help and support. And it is therefore important that those who work with children are sensitive and able to notice the signs of child maltreatment and changes in child's behavior. Next slide, please. In order to identify that it is domestic violence, it is necessary to focus on this topic briefly in theory. Therefore, we talk about forms and specifics of domestic violence and about the dynamics of an abusive relationship. Then we discuss the most common myths about domestic violence, and we pay attention to impact of transgenerational transmission of survivor or violent person behavior. Next slide, please. A slightly more practical part was devoted to specific recommendations on how to proceed in helping children experiencing domestic violence and how to support parents, survivors. If you look at helping the child, then teachers or social workers should be able to identify the physical signs of child maltreatment and changes in the child behavior. We discussed which actors may be involved in helping the child, what their role is, and where to find context for them. We encourage the participants not to be afraid to report cases of child endangerment to the Child Welfare Authority and to establish good cooperation with them. And the next important thing that participants should take away from the course, recommendations on how, when, and where they can talk sensitively with children, how to support them and give them basic tips on how to ensure their safety and what to do when violence occurs. I think you will see an infographic with a security plan later in this presentation. So you can have a look. In supporting the parent, survivor, teachers or social workers or other helping professionals should be able to identify or respond to a message that the parent is experiencing violence, be able to communicate it sensitively and offer appropriate help. And it not has to be something big. Help may consist in offering contact to specialized counseling centers for victims. And the main idea of this is that if we support the parent, survivor, to solve their situation, then by supplying the necessary competencies, information, and support, it is just the parent, survivor, who can provide the child safe and quiet environment and who can stop the transgenerational transmission of violent person behavior. If you don't have any questions, thank you for your attention, and I'll pass the floor on.
Okay, thank you, Marketa, for your speech. It's a really important topic, and I am very happy to have you in the project. because I think it's important to talk about these things. Thank you. Now I would like to tell you several words about the dissemination of our outputs. Before we proceed to the description of the training we have developed, even if I think this is it would be the main part of this meeting, but please let me say several words. We were very lucky during the selection of trainers. We wanted to find people who are really well experienced and who are located around the whole Czech Republic, in all 14 regions of the Czech Republic. It is really important that the trainers of the training are from the regions where they will then when they will then be active, because they know the local situation, they know the local organizations and people.
Yeah, we are sorry. Yeah, Leona probably has some technical problems. So, Christina, can I ask you please to continue before Leona gets back?
Yes, of course. Hello, everybody. I will take over, as it seems that my colleague has some issues with the internet. What we wanted to mention in here was that our trainers, it was important that they would do the first training, the pilot training, in the area where they actually are based. So they know the area the most, they know the organizations that are possibly available for the schools and the social services around there, and for most importantly for the children. And so we try to match the schools and the trainers, sorry about my voice, the schools and the trainers in the area where they would continue in the future, and hopefully collaborate in the next years.
Leona is back, Tinka, so I think that she can take over from now.
Perfect.
Yeah. Yes. Thank you very much, Tinka. I'm really sorry. This happens usually on the time, just on the time when I have to speak. So sorry. I think you all know it, hopefully. So I don't know what have you say, Tinka, but what I wanted to say was that on the dots on the map represent the places where the training took place. The bigger the dot is, the more trainings took place there. And you can see that it is more or less all over the Czech Republic, which is great, and we are happy for it. And also there are 3 places in abroad, in Poland, Slovakia, and Hungary, when we disseminated the training in the Visegrad region. We were there in 3 places: Pulavy near to Warsaw, in Bratislava, and in Budapest. Yeah, so next slide, please. I'm sorry for the... Yeah, here you can see several pictures from the training, so you can make a picture about how did it look like, what did we do. We try to show all the things that the people can use during their work in schools and during their work in social services. We are aiming to create the training the most interactive and playful and as possible, because we believe that the more the participants are involved themselves in the training, the more effect it brings to them. So you can see several pictures of our activities there. So my last slide is about the dissemination to the V4 countries. Due to the current situation in Ukraine, even if we didn't plan it. The project came in the right moment because of the refugee crisis in all the countries of the V4 region. And I would like to tell you that all the materials that we have created are translated to all 4 V4 languages and also to English, and are ready to use if you would like to participate and, for example, use our curriculum in your country. We will be happy to cooperate with you and to tell you everything what you need so that you can work on it. I am very happy that in Slovakia the trainings already took place, and our partner Inkluzentrum already organized several trainings. Yeah, and so thank you for your attention. Sorry for this disruption that took place. And now I would like to pass the floor to Tinka, and she is the representative of the expert team, and she is going to lead you through the part, really the part of the where we are going to describe you the content of the training. So Tinka, the floor is yours. Thank you.
Thank you very much, Leona. I'm going to continue with the methodology and the evaluation first, and then we are going to go into the content of the training itself. So the name of the training is Trauma-Informed Approach as an Answer to Children's Challenging Behavior. And it was disseminated to teachers and social workers, as you already heard, in Czech Republic and the Visegrad countries. So in the next slide, I would like to show you the key concepts that we chose for building this training. So we chose the Childhood Adverse Experiences Studies. You might know it as ACE study, which was originally done in the US. We also took in our attention a polyvagal theory, a neurosequential model in education. That was also a very important part of the training, and some positive behavior interventions and support. So these were the key concepts. And in the next slide, I'm going to show you the time duration. We chose 16 hours in total. It was kind of the compromise between like what we wanted to cover and between the time capacity that the teachers and the social workers had. So 16 hours, 1 hour, 45 minutes, and we done it either in 2 days, 8 hours each, or 4 days, 4 hours each. Next slide, thank you. We had in the end 1,120 participants from education and social services. We had teachers, primary, secondary schools. Also, we went to children's homes, so we trained the staff in there. And we also educated social workers from different NGOs and child protection services in the Czech Republic. We also had psychologists and other professionals working with children. And as I already mentioned, it happened in Czech Republic, Slovakia, Poland, and Hungary. In the next slide, I wanted to show you the kind of subjective feeling of the teachers and the social workers that went through our training. They filled out evaluation forms, and we found out that they felt that the use for their professional and personal development was quite big. So if you can see the blue long, actually I don't know how to call it, line, let's call it a line. It's strongly agree. The gray one is agree. So about 86% of people agreed that it was very useful for their professional development, and about 85% of people believe that it was also important for their personal development, which I think it's very interesting that it really boosted some sort of development, not only on the professional basis but also on the personal one. So in the next slide, I also wanted to show you, this is an overview of the different parts of the training. So I'm gonna describe the content of the training later, but in here you can see the overview. We talked about different causes of challenging behavior so the teachers would understand what is actually behind challenging behavior in children. We would talk about the impact of toxic stress, activation of the stress reaction system, and also other things like regulation, co-regulation, de-escalation, some kind of difficult behavior, in identification of child at risk, etc., etc. And in here you can see the blue part, it's for the social sector, and the gray parts, it's for the education sector, so teachers, etc. And it's interesting that they found, or the social workers found domestic violence and identification of a child at risk somewhat more important. It was an important topic for them, more than in the educational sector. And in the educational sector, on the other hand, they found that the neurosequential brain development and the supportive environment, PBIS, multidisciplinary cooperation, it was somewhat similar to the social sector, but in general, functioning of stress in our bodies, the neurosequential model of the brain, trauma-informed approach as such, they found it important and interesting. So I just wanted to share this overview, and we can go to the next slide. Oh, and we already have, so we are going to move to Katerina, and I'm just going to shortly introduce our peer advisory group that she's going to talk about, because building our training, it was depending on us as professionals, but also on people that experience something difficult in their lives. So we also consulted them, and it was a very important part of the process of building this training. So I would like to give the floor to Katerina, and she's going to walk you through the peer advisory group.
Thank you so much. So hello, my name is Katerina, and I will just shortly talk about our peer advisory group. That's how we called it. We were really happy to and really lucky to be able to cooperate with a few young individuals. They were all people who in their childhood experienced some traumatic experiences, and they were able and willing to share it with us. So what we did was that in the beginning of the project, when we were assembling and creating all the materials and the curriculum for the training, we had one big focus group with those young people, and I think the outcome of this group session really helped us to somehow shape the project key messages. They told us what was really important for them as or when they were kids, what are the messages they would want to tell their educators or the social workers they met when they were young. And I think it also really helped us to finding out the parts that we really want to stress out, and for the way how we want to pass them to the people in the training. So this was in the beginning, but also throughout the whole development part, we were in contact with them, and they cooperated with us in, I would say, two main ways. So please show us the next slide. Thank you. And I would say that one way how they were in contact with us and with the project was that they contributed with their own experience. You could see and hear them when you were participating in the training. So it means that in the project, in the training materials, in the handbook, also in the PowerPoint presentations, you could see parts of their experience, of their stories and their quotations. And we also heard them talking to us through some short audio recordings that we took. So this was one way. And the second way was not only about their experiences, but also about their opinions. And it was really important for us that they could see all those materials when we were developing them, and they commented on them. This also applies to the final version of the materials, so they saw them before we said it's good to go and we started the training. We are also now hoping we would meet them for the evaluation part of the project. We will share with them all the outcomes that we had in the pilot trainings, and we will still be happy to hear some of their comments for the continuous or for the continuation of the trainings that we will still have. So this is the theory, and we are happy that we can at least shortly introduce our two young peers to you. So I will not talk anymore, but in those two slides you will hear just really short audio recordings from Linda and also from Patrick, and you will just hear a bit more about their background, what they experienced when they were kids, and also a bit about their stress reaction that they had. Okay. Okay, so I will pass the floor back to my colleague and then we will switch again.
Thank you, Katja. So we could hear some of those peer consultants, those young people that we had, and I just wanted to stress that their expertise is equally as important as our expertise as the professionals in the topic of mental health. So thank you again. And now I would like to introduce the training content as such. It's going to be divided into 4 parts. And the first part is going to talk about the frequency or let's say the numbers of of people or children that experience something difficult and its impact on their future life. As you could already hear from Lenka and Marketa, the numbers are quite disturbing to hear how many children are actually experiencing something difficult. And for that, we wanted to have some evidence and some studies. So we used the Czech version of a study, the Adverse Childhood Experiences, that is originally from the US. The aim of the study in this training particularly, it was to establish the link between the experiences that the children experience during their life. If those experiences are difficult, then it somehow affects their behavior later on. So this kind of risky behavior, difficult, challenging behavior, there is a possibility that is connected to the experiences that the children have. So in the next slide, if I may ask, we prepared some interactive activity for you as well, because we want to give you an authentic taste of what our training is about. And we really want to involve our participants as much as possible, because we believe that what you experience yourself, those things you remember the most. So I'm going to ask you if you can scan this QR code from this slide, or if you can click on the link menti.com. If you do that right now, you can enter the code 28814483, and you should see a question. I hope that you all have that, and if not, feel free to message us into the chat. If you do, try to answer the question, what from your perspective are some of those difficult experiences? Maybe you have you work with children yourself, you experience something like that. So try to remember, try to imagine, what are those difficult experiences that the children can have in childhood, and try to write that down. And in a second, we are going to have a look at what we think that adverse childhood experiences actually are. Perfect. Thank you very much. So we have some of the first answers in here. And as you can see, this method, this principle allows us to really be part of the process. It's not only that we rationally accept some kind of information, but also we reflect and think about it and take an active part in thinking what are actually those things that are influencing our children in the classrooms and elsewhere. So thank you very much for your efforts and for your words that you wrote down. We can see that some of those things, I'm just going to explain, probably you already know that, but those words that are bigger, it means that they are more frequently written. So poverty, abuse, neglect, divorce, those seems to be the most common one in your answers. And domestic violence, something that Marketa already mentioned. Social issues, poverty, okay, that's the same thing. Sexual abuse, fear, discrimination, divorce, serious illness, sexual violence, humiliation, physical abuse, exclusion, etc. Thank you very much. I would like to invite you for the second question. Thinking of the background, so children can experience, some of them can experience some sort of things that you described just now. And I have a question, who or what can change the outcome of such challenging experiences? So the outcome of these experiences, we can all imagine that are probably difficult emotions, difficult behavior, it can come to that, but what or who can change that? So feel free to write some answers down again. Mm-hmm. So we have teachers, schoolwork, school environment in general, parents, psychologists, trusted adults. Thank you. Social services. Yeah. Environment. This is for the second time. I guess classmates, maybe. Family members, therapists. Yes. Increasing number of protective factors in that child's life. Yeah. So protective factors, the more the better. We all, everybody. Yeah. A person that takes care. Friends, relative, friend. Thank you. Amazing. Thank you for thinking about different ways and support systems that we have for the children. And I would like to follow on your answers, because you are all definitely correct. We all, social services, teachers, all the professionals working with children, family, environment, those are all important factors. And this is something, maybe we can go back to the slides, Irka. Thank you very much, everybody. This is something that we talked about in our training. Not only that we educated or we try to show people what are the negative experiences that the children have. Maybe in the next slide, Irka, we also have the impact of those experiences, those negative experiences that the children can have in their life. But that's something that you can find in the ACE study. Maybe go back to it in the slides later on. But what we thought was the most important thing, maybe Jirko, you can go to the next slide, is also the kind of thinking about the well-being of the adults. So all the support system that you mentioned, it's also depending on how well we take care of ourselves as well. And that's something that we really try to stress to the participants in our training, that we are all the adults around the children, they can be the support system, but we need to understand as well how stress and all these things function in our body, and how our own well-being can be improved, so we would have better resources ourselves to regulate not only ourselves and but also the child. So if we go to the next slide. Perfect, thank you. We talked with our participants. We also talked about the long-term kind of impact. So at the beginning, we had some adverse childhood experiences, and then we talked, especially with the teachers, but also the other professionals as well. What is the social, emotional, and cognitive possible deficit that can follow? So it was important to understand that if there is something difficult in a child's life, then there could be some sort of deficit in attention, behavior we already mentioned, also social deficit, emotional regulation deficit, etc., etc. So we wanted to really go into depth with the participants about that. And then we also talked about who and what can help. And yeah, we can go to the next slide. And I already mentioned language communication skills, skills related to attention and working memory. All of that could be potentially affected by difficult experiences in children's life. So there was a very important part for our teachers, social workers, and all the other professionals to understand that and make the link and discuss these topics. And if you go to the next slide. We also talked about stress and so what is the impact of having this high, unpredictable, big, long-term or frequent kind of stress. It makes us more vulnerable. And we talked about toxic stress and its impacts, and also we try to dive into what to do about that. How can we make the stress more positive in a way that we would help the child not to become vulnerable, but become more resilient. Make the whatever is stressful, make it more predictable, maybe moderate, have more control about it, etc., etc. So I won't go into depth in here, but that was also an important part that we discussed with our participants. In the next slide. There was the sequential development in the brain architecture. We already mentioned that. It's important also the neurosequential development of the brain, understanding how stress is actually affecting our body, and the brain can tell us a lot about that. The brainstem, the functions of the brainstem and the connection to stress, also the limbic system, the center of the emotions, etc., etc. So I'm going to describe that a little bit more later, but now let's go to the next slide. And in here, with the participants, we just talked about if there is a difficult experience in childhood and children's life, then the ability to regulate from the top down, it means rationally, by thinking, by analyzing, etc. If we experience something difficult, we are less able. It's more difficult for us to have this top-down regulation, because sometimes the emotions are just too much overwhelming, and the brain kind of goes more into the fight and flight mode, or the freeze mode, and the rational part is not that accessible. So we also wanted the teachers and the social workers and others to understand this concept, how well the children can actually react to our verbal instructions and this rational regulation. Okay, let's go to the next slide. And in here, there was also an important part of our discussion about demanding children versus children who have demanding life. So basically what we discussed with the professionals as well was that the children simply very often, they just have something that is very difficult for them, and therefore their behavior becomes demanding, but it's not them that are demanding. And now I would like to pass the floor to Katja, and she's going to walk you through the part 2 of the content of the training.
Okay, thank you. So next slide, please. So in this part of training, which is the second part, we try to build on what we learned in the first part. Now, please try to remember what you heard during the video about the brain and about our stress response. And in this part, it was really crucial for us to go more in depth on the topic of our stress response system. In this part, we introduced to the participants of the training the state-dependent functioning. This is a theory introduced by Dr. Bruce Perry, American neuroscientist. And this part, I think, was also really useful for the participants in two ways. I think it really linked what we can learn about the stress response, which we see in the children that we work with, but also it can teach us a lot about our own stress response. And I think this part of the training was also really good or highly evaluated by the participants, because this was something that they could also use for their own self-care. So I will just try to really simplify this whole concept and show you those 5 dots. You can see it as a continuum going from left to your right. And this is something that we experience when we are under some stressful event. So if we go from the left, the first state is calm. This is a state when we are not affected by stress, or we can really well regulate ourselves. Alert is something that we experience when we meet other people. I think this is the state that we are in most of the time when we are at work, when the children are at school. They are some stimuli. I hope I say it right. There are some things that we cannot control, but we still can regulate ourselves really well. And we can now focus on the three states: alarm, fear, and terror. These three states were really important for us as something that is or some stress. This is a stress response, which when the child experiences, they really need our help. They need our co-regulation, we would say. So these three states are states of elevated stress response, which the children who experience trauma experience a lot, and they can experience it more often than their peers at the school or in other environments. So this is why we try to bring the focus of the participants to be able to distinguish between those states. Please show us the next slide. You can see an infographic that we made, and that could be used also for the children at schools or at other places. And you can also maybe go through it and see how we described those 5 states. Bear in mind that this is some kind of continuum, so you can your stress reaction can somehow fluctuate. You can be more alert, and then you can be more calm, and it can also look different in various people. So this part, as I said, was important for us as a base for the participants to also get to know themselves a little bit better, which is an important step if you want to help to somebody else, to help them regulate themselves. I will try to explain it a bit more on the next slide, please. So this is the second topic of this second session, and that's regulation and co-regulation. The term regulation is used when you are regulating yourself. You are trying to calm yourself down when you are under stress. And the term co-regulation we use when you are helping to calm down another person. In this scenario, it would be a child or a young adult. I will try to simplify again, but don't worry, we will go through this, I think, in the next part as well. We try to link this part with what we learned about the brain. So if we go on the continuum from the left to the right, you can maybe you can now imagine your own stress reaction that you have sometimes. We all do. So you can imagine that if you are calm or alert, this is some kind of stress that you can regulate yourself quite well. And in this part, it would help you when somebody will talk to you or you will talk to yourself. You will be just thinking, planning. This kind of regulation will help you and is linked with the top part of the brain, which is cortex. But if your stress levels are higher, we can say that you are experiencing alarm or fear, then this kind of regulation will not be sufficient. You will need something else than just words. And in this part, we talk about relational regulation. So you need to feel a safe person or some safe relation that you have with somebody. And if this is not enough, and that can also happen if you're experiencing fear or terror, which is the highest stress response you can have, and it can also somehow go into more physical experiencing. You are shaking, you are not able to focus on anything. Then not words and not the presence of somebody will help you. And you can regulate yourself by some somatosensory stimuli. So by movement, by some other sensomotory experiences. We will talk about this, I think, a bit later. And maybe also show us the next slide, please, Jirka. This is another infographic that we made. It also can be useful for the children. You can go through it yourself a bit. And now please think maybe about how to distinguish those three regulations, because we will try a small activity now when this would be useful. So I will try to share my screen. Maybe please somebody give me a signal if you can see Jamboard now on your screen.
Yeah, we can.
Great. So now you're not able to access the link, but you will be in a small moment. I just want to show you how this environment works. Maybe you know it already. So in a moment, you will have a link to this Jamboard application. And I think what's important is this panel on your left. And we will just use one function, and it's this one, is the post-it note. You will be able to write your answers on the post-it notes. And the first question will be, which situations can put you or your children or children you work with in a state of alert, fear, or terror? And I just want to show you the way we will be responding. So you can choose which color you want to have on the post-it note. We will use the yellow one for yourselves. And we will use the blue one for children. So I think now, Jirka, please share the link. And you can access.
You can find the link in the chat now.
Great. So if everything works, please feel free to type your answers. You can type as many as you want. So for now, please think of the situations that put you in some kind of stress, and your stress reaction is quite severe, I would say. It's something you maybe need help with, or the children need help to regulate themselves. Great. So I see feeling of failure. Now I see a child doing something dangerous, climbs on the window in the class. So these are situations that put you under a lot of stress. It can be something from your workplace, or it can also be personal if you want. So we can see the loss of a loved one. Car accident. This is a good example of really big load of stress that really puts us in in a really severe reaction. Now we can see moments that put a life of a person in danger. Exactly, great. And I will go to the ones on our right, which is some situation that puts the children under a lot of stress. So that could be bullying, aggression from the classmates, exposure to triggers associated with prior traumatic experiences. Great. Feeling I cannot cope with it, with situation or with some task. If there's nobody to believe. Oh, great. When I'm hungry, that's a great one. I think you can see that a lot of those could be used for children and for ourselves as well, I believe. So we have being lost, a test, which is also a fear of failure. Great. My aggressive reaction, screaming. Great. Thank you so much. So for now, I think we can see the purpose of this activity, that you can see there is a lot of situations that you can really experience in a daily life, either as an adult or also as a child. For example, at school, as you can see, there's a lot of potential stress situations. So this is not the only task I want from you now. The second one will be a second question, which is what helps you or the children to get out of this state of alert, fear, or terror? So simply, how do you regulate yourself, or how do the children regulate themselves if they are experiencing exactly those stresses that you wrote on the post-it notes? So please also use this colors. So I will just look. It was yellow for ourselves and blue for children. Okay, so let's have a moment to think what we do, or what do the children do when they are under stress. And when you have your answer, you can also look at the bottom of the page. So the task is not that simple. And you can see the parts of the brain that we talked about. And you can try to find the place for your post-it note in according the part of the brain which is linked to the most. So you can decide if the activity or the thing that you wrote is more connected with the body, with the movement, or with the sensory motor tools, or if the activity is more connected with your or children's emotions and relationships, or if it is connected the most with your reason, with thinking with instructions, and so on. So this one may be a bit hard because we didn't have that much time to introduce this whole concept, but I will help to sort them out. Okay. So I will go from left to right, and we have there the regulation which is connected with the body, which is connected with the brainstem. And I would say from those post-it notes that I can see, there is deep breathing, there is eating, great. Something sweet, great. I hope you are regulating yourself right now. This is the benefit of the webinar. There's some hot beverage. Sheldon recommends too. Okay, great. Great. There's breathing as well. I will be quick, so I will go to emotions and relationships. So I would say there is definitely a beloved person. There is, I would say, I don't know, maybe cuddle. Cuddle could be linked with somebody who is very close to us, or maybe that could be connected also with the body as well. So maybe there in the middle. And then I would go to the last part, which is reason. And I think I see quite a lot of things connected with it as well. I would say it's making lists. Then self-calming skills. Okay, there's written associated with limbic system. Okay. Recognition of the situation. Okay. I'm sorry, I'm not that focused because the post-it notes are still moving, but I would just want to talk really little about this activity, which when we did it during our training was for maybe an hour or more. And this activity was very well received because it linked their own experiences as the educators or social workers with experiences of children. One outcome of this activity could be that the situations that put us under a lot of stress and also the regulation that we use could be really similar for us and for the children as well. And what I would say was a big aha moment during those trainings was also that we really use a lot regulation by our body. That means what you wrote on the left part, eating, breathing, taking some time, finding safe place, and so on. And when you maybe look at your work with children and at the environment that we work with, it is not always really easy to be able to work with those kind of regulations. And maybe sometimes the first thing that pop into our minds are the regulations by reason, which, as I can also see in this chart, is not used that much, or is not preferred that much by ourselves. So I think this is enough for me. I will maybe ask Jirka to put the presentation on, if you can. Great. So thank you for your activity in this little technical experiment. I'm happy that it worked. And I will pass the floor to my colleague Tinka to continue.
Thank you very much, Katja. I'm going to ask Jirka to put the presentation back on. And in the meanwhile, I just remember that I also once asked the participants about what kind of regulations are accessible to the children at school. And it's quite interesting to actually realize how much, well, or maybe how little we know about regulation and what is actually the most effective way how to regulate for children. So that would be also an interesting discussion. So we are going to now to the part 3 of our training, and we gave a little homework to our participants. So basically, when they finished the first 2 parts of the training, they got this sheet, this homework, where they were supposed to learn a little bit more about themselves. As Katja already mentioned, our goal was to make them more aware of their own stress reactions and of their own regulation systems, because the more we can consciously regulate ourselves, the better co-regulation we can offer to the children. So we gave them the state depending functioning scale, and we asked them to kind of monitor themselves for a week or 2 and write down a short description of a situation in which they either felt calm or alert. And then the question would be how to actually sustain that. Or they would feel alarmed, at fear, or at terror. And then the question would be, how do I actually regulate these states of stress? And they had some questions to guide them through that. How do I feel? What are my thoughts? There was an interesting question, what can others observe in terms of my behavior? And then what helps me to feel better, or what helps me to sustain this state if it's calm or alert. So this was the self-awareness kind of exercise and training that they did for themselves, and it was supposed to also aim at increasing their own well-being and awareness of their own state. So in the next slide, Irka, I would like to show you. Thank you. Those different types of regulation. So as Katja already explained, we kind of categorize the types of regulation based on whether we are using our body and our senses, that would be the sensomotoric regulation, the brainstem, or whether it's more relational, that would be the limbic system, or whether it's purely rational, this top-down regulation. And then we went into each category in bigger depth. So basically this top-down regulation, that's the rational mind, we went into that, and we talked about if we are in the state of calm and alert, that's when we can regulate from the top down, from the rational part. Then we can reflect, and we can maybe make some plans and prevention for the situations when we felt stressed out. So we can access this rational part of our mind, describing what happened and kind of building on that. That's the most effective way. As Katja already mentioned, if we are not at this calm and alert place and we are more going towards the right, towards the alarm state, then the rational regulation is more effective. So we also talked more in depth about what is it to actually consciously regulate through this limbic system, through emotions, through this relational approach. Because the verbal instructions and disciplining and this, rational part is not that very effective in this state. So we focus very much on that. We talked about facial expression, body posture, gestures, tone of voice, and we also tried a lot of things. So in the next slide, there was an activity that we tried with our participants. They created groups of 3 or 4 people, and one of them had the role of a child, a pupil, a student, a second one the role of a teacher or social worker, and then an observer. And then they switched roles, so everybody would experience every role from these 3, and they would actually have some sort of difficult behavior that they would know from their own experience, and they would just reflect upon how this behavior is affecting my state. Maybe the stress levels would go higher, maybe the body would react in some way, and they would get, again, more experience and more lift kind of experience and awareness of how do I feel and what works the most when we have some sort of difficult behavior going on. What can I do for myself first, and what can I do for that child? So that was very much based on the practice. And in next slide. And if we can have the next slide, Dirka. Perfect, thank you. We moved to sensory regulation. It's hard to pronounce that word. That would be the last 2 stages of this scale, the fear and terror. And that would be already, as you already mentioned, the brainstem, the body and the senses. That would be really about what can we do if we really feel stressed to that degree that rational mind is not really helping. We cannot really pay attention. We cannot really benefit from that communication from the rational part of the mind. Also, maybe the relationship already is not enough. And so some sort of body-based, sensomotoric-based regulations are the most effective. In this stage, we also explain the difference between fight, flight, and freeze reaction, because they tend to be quite different in terms of regulating them. So if we go to the next slide, I wanted to show you some tools, sensomotory aids that we used. We introduced different anti-stress kind of toys and tools and gadgets that the students and the teachers as well would actually use in the classroom, outside the classroom. They would try different things and kind of feel into what works best for them. And in the next slide, we also explained the relaxation corner and the rules for the relaxation corner. So that's another possibility that you can use the tools. And also, if you need some space for yourself, maybe switch off for 5 minutes or 10 minutes, then it's really good practice to have a relaxation corner or a relaxation room somewhere. So the child can actually just really switch off and relax for a bit. And there should be rules as well, including maybe some timer, etc. And also there should be definitely some contact details for some well-being consultants, people that would help the child with the mental health. So this was also an important part. And then we talked about brain breaks and different relaxation and prevention kind of activities during the class. So the teachers actually went through different activities, different things where they could experience a minute or 2 minutes long exercises. They would just switch off their brains. It would give this pause to their brains a little bit and help them to regenerate and feel better. Actually, I would like to just ask you to do a little bit of similar thing because you are behind your computers. Maybe your backs are a bit stretched. I want you to pay attention to your body for a little while, just half a minute, not more, and just check in with your body and feel how is your back doing. What about your neck, your shoulders? Maybe you can move your shoulders a little bit up and down, back and forth. Maybe you can do some round circles with your shoulders a little bit. Maybe you can put your head from left to right. Maybe also the jaw. Relaxation of the jaw is very important. Sometimes when we get stressed, we tense our jaw. So put your tongue down to the lower part, and also you can move your jaw from left to right. It's also very helpful. Sometimes when we keep our jaws very stiff, and we can get a headache from there. So it's very good. You can close your eyes and you can move your eyeballs up and down and left to right. That also helps a little bit. And you can massage your face if you feel like it. You can just stretch your arms up or to the sides, up to you, whatever you feel like. And just breathe in and breathe out, some deep breath. Ideally from your nose down to the belly. And what is really effective is prolonged exhale. So breathing in, maybe stopping for a moment, and then breathing out as long as possible. So these are little things that you can do for yourself. And we wanted the teachers to experience that and feel that there are really short things, little things that they can do for themselves. And it already helps. So thank you, and we can move to the next slide. Thank you, Irka, and thank you for everybody. I hope that you feel a little different, a little bit more relaxed maybe. We included some activities to the brochure, to the publication that we created. and we introduce some stimulating activities or some calming activities, little tips that the teachers can do in their class. And in the next slide, in the next slide, thank you. We also talked about supportive environment. So it already comes to the relaxation corner, etc. And we asked the teachers, what can you do for yourself and for your children to really cover all your needs? And in the next slide, I'm going to show you the Maslow pyramid of needs. And we talked about all 5 layers, or I cannot think of a better word right now, of the Maslow pyramid of needs. And we asked the teachers and the social workers and all the participants to reflect, how do we actually fill every single layer of these needs for ourselves in our organization and also for the children. So it was very interesting to actually discuss these things with them, and they created a lot of different kind of goals and plans for themselves to put into place. So we can continue to the next slide. And I'm going to give the floor to Clara, and she's going to walk you through the part 4 of our training.
Okay, hello everybody. I'm going to talk about the 4th part of our training, which was about cooperation of schools and social services and the Agency for Social and Legal Protection of Children, for the Czech speakers OSPOT. What is very important is that the schools and the agency, they work close together, the school or the social services. The school is obliged to report suspect or a suspected child at risk, and the agency provides the feedback then to the school. The agency is also allowed to enter the school, and they work close together to take care of the child at risk. Then they evaluate the case together, and they can also contact other services and other supporting organizations. Next slide, please. Other organizations and something in the chat. Other organizations are, for example, the social services, such as asylum facilities, social activation services, and other NGOs organizations. And their main goal is to cooperate with the agency and also police if needed. And they can provide the follow-up support for the family and for the school as well. And on the right side, you can see the police, and their main task is to gather the evidence. Sometimes the teachers at the courses were asking us whether they can gather the evidence, for example, take pictures of the child or of the bruises of the children, but we said no, because that's the work that police has to do. So the police can work with the school, but mainly they work with the agency. And what can they also do? They can evict a violent person from the household, which is sometimes very useful for the child and for the family. Next slide, please. Then in the whole budget, the whole package of supporting services, there's of course healthcare and mental health professionals, and their main goal is to do diagnostic, of course, and therapy. They can cooperate with the agency, with police, with the school as well, but that is not that common. And of course, they can observe they can see the clinical signs of the maltreatment. Next slide, please. I'm going really fast, so because we know we're getting late in the webinar. What we can have in the Czech Republic is case conference at school, which is a facilitator-led meeting, and its main goal is to map the situation of the child and also the family. The parents can be involved in that, and also the school representatives, such as class teachers, school counselors, and other support people from school, and also NGOs and other external workers, such as pedagogical, psychological counseling service, Agency for Social and Law Protection of Children, and other NGOs. Next slide, please. During the course, we also talked to the teachers and to the social workers as well, what they can do or where they should or shouldn't do. So you can see on the left side in blue columns and on the right side on the red columns. So the blue ones, what to do, and the red ones are what not to do. What was very important, as I said before, is that taking evidence is the job of the police. And also what was very important is that sometimes teachers would like to promise the child the confidentiality. Sometimes the kids ask for the confidentiality if they talk to the teacher, but that's something we can't promise them because we know that we might pass the information further and further to other professionals. Okay, that was pretty fast, and I'm going to pass the floor back to Tinka. Thank you.
Perfect. Thank you very much, Clara. So we introduced all content to you of the training, and we would like to mention also the future goals and the vision that we have with that. So we created something that we introduced to 1,120 people in the Czech Republic and in those V4 countries. And now we would really like to go further and introduce this trauma-informed approach to more organizations, maybe even more countries and more sectors of child support system as well. So dissemination to educational and social system, that's something that we've done, but we also want to go into nursery schools and children's homes and focus on that, and maybe creating a specifically designed training for these circumstances of the teachers in nursery schools and the staff in the children's homes. Another goal for us right now would be the dissemination to other sectors as well, like police department and Department of Justice, also maybe the health services, the integrated part of health services, etc., because they all work with children. And I think it's very important. We all think that it's important to make this cooperation across all sectors. Student empowerment, that's also something that is very important from our perspective, and it's right now there are not that many trainings for students where they can learn and kind of get better aware of their own stress reactions, regulation systems, mechanisms, and we would like to maybe create something short, something that would be effective for them to also learn about the functions of their own bodies and brains, and how the stress affects their behavior and then their feelings and emotions, and how they can regulate effectively. So that's also our wish and our goal. And of course, now we have 58 trainers that are ready to do this training. And we would like to sustain them and have a long-term cooperation, maybe offer them some further support so they would be good and ready for just doing this training for as many organizations as possible. Nonetheless, there's another thing that we would like to do, adding some skill-based follow-up training. So as you can maybe see, there's a lot of topics included in this training. So adding maybe some deeper dive into different skills, like communication with a child at risk, maybe some other things like crisis intervention, etc. So that has to kind of maybe come from the needs of the participants that are going to attend our training. So based on that, we would like to build some more skill-based deep dive trainings that we could offer to them. And as I mentioned already, cooperations with other people, organizations, and countries, that would be the goal for us, because cooperation, not only for the professionals, but also for everybody who has some sort of drive into helping the children and supporting the whole system. That is something that we really strongly stand for. We have one more audio quotation from our peer consultant, Linda, and she is actually a teacher right now, and she's using her own experience in her own practice. And we would like you to hear her experience as a child and also her point of view and perspective on how to work with children who might be experiencing something difficult in the classroom. So let's hear what she has to say. Thank you very much. And now I would like to give the floor to Leona.
So thank you all of you for your attention. There are 2 hours behind of us when we tried to pass you all our enthusiasm about what we have done during the last 2 years. And I hope it worked. And we will be very, very happy if you contact us. And if you have any questions, if you would like to that we send you some materials that you could use, anything, we will be very happy to cooperate with you. And we have a really lovely message in the chat from Romania. And also, please write us, and we will find what can we do for you, and what can we do, like our future step. Maybe something as you described there could happen, I don't know, maybe in the next project or anything like this. We will be extremely happy to share what we know and what we have.